Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, welcome to the Gastro Girl podcast. We're so excited. This evening we have the amazing Dr. Benjamin Levy, who's a gastroenterologist with the University of Chicago. He's also a cellist and he's the organizer of concerts. And one of the ones that we're going to talk about this evening is the Tune It Up concert that's going to be coming to you live virtually on March 30th. So we'll get into that a little later. But first, we're going to talk about colorectal cancer and colorectal cancer awareness, since it is March and it's March Colorectal Cancer Awareness Month. So first of all, welcome, Dr. Levy. So excited to have you here today.
Thanks for having me on your show.
So the first thing we want to talk about is there's been a lot of news articles that are talking about the increased incidence of young onset colorectal cancer. We have new screening guidelines that came out, a year ago. So just want to give a little overview of that.
Basically, we've been seeing early onset colon cancers happening in younger and younger patients at an alarming rate, particularly for patients age 49. We saw a significant increase in that patient population. And the thought was to lower the screening age from 50, where it had been, to 45. Initially, the American Cancer Society changed their guidelines, and afterwards, the American College of Gastroenterology and the other GI societies followed that. And the thought is that if we were able to remove polyps in patients around age 45, we can prevent those polyps from turning into cancer. Polyps are small growths that happen as we age in the colon. Some of it's genetic, some of it's probably diet related. Colonoscopies are a preventive medicine strategy. And if we can remove polyps, we have biopsy forceps and snares that we use during our colonoscopy procedures, and we can remove the polyps, send them to a pathologist to see what they actually are, because there are different kinds of polyps. But when we remove a polyp, it literally prevents colon cancer. So the thought was to try to do it at earlier and earlier ages.
In your practice, are you seeing, personally an increase in that as well? Just even though the statistics say one thing, what's, the reality in practice, are you seeing that as well?
Yeah. What's scary is when I do a routine colonoscopy on a patient that doesn't have any symptoms at all, and we find a significantly large polyp. We're talking on the range of 1 to 2 centimeters in a 45-year-old who's just trying to be good with their health. Their primary care doctor may have prompted them, or maybe they heard about the new change in the guidelines, and they came in to take care of themselves, totally thinking they're not going to have any polyps at all. And then I find a 1 centimeter or 2 centimeter polyp that we remove. And it's a great feeling for us as gastroenterologists when we're able to remove the polyp, afterwards come and talk to the patient and say, hey, it's great that we did this, because you would have developed colon cancer if we had not done the screening at age 45. If you had waited till age 50, this thing really would have grown and had a high likelihood of turning into a cancer. So we're seeing that. And unfortunately, we're also seeing cancers in patients even younger than that. So it's going to be super interesting to see, with all this new data and information that comes out, whether we actually have to decrease the age even lower than that to be in colonoscopies at ages younger than 45, but currently at age 45. And I'm not trying to scare anyone, but the message is, if you have persistent rectal bleeding, you should come and talk to your primary care doctor or go see a gastroenterologist. I'm not talking a couple of drops of blood one time, but if it's really persistent bleeding, you need to get it checked out. When we're diagnosing cancers in patients in their 30s, that's usually the presentation. And so it's not like they weren't having any symptoms at all. They came and sought medical care, and then we were able to diagnose them. So it's age 45, but if you're having any unusual symptoms that are concerning, definitely go and talk to your primary care doctor, an internist, or a family medicine doctor.
That's such great advice. And we've talked to patients over the years, and even recently, I remember there's one gentleman who ignored the rectal bleeding. Now, he didn't have colorectal cancer, but he was diagnosed with IBD, but he was suffering all this time. He kept ignoring the rectal bleeding, but he actually had a serious health condition that he was ignoring. So what you say is so appropriate and so important. Like, don't ignore it. What are some of the other signs that for patients should be aware of when they should see the doctor?
Okay, so there's several alarm symptoms that we always emphasize to patients, and we're teaching our fellows and residents and medical students. These are the things that we always teach about. So alarm symptoms include unintentional weight loss, new onset anemia, persistent rectal bleeding, or unusual rectal bleeding. And the other key thing to look out for is a change in stool caliber. So the classic description is pencil thin stools, but anything that's a change in caliber of your stool or how thick it is, you should at least talk to your primary care physician, especially if it's persistent. We're not just talking about a one-time thing, but something that's persistent and concerning.
No, thank you for that. Now, colonoscopy has always been the gold standard for colorectal cancer screening, because it can not only detect, like you said, with the polyps, and it can remove them, which really prevents the cancer. Now, there's a lot of, we see the commercials on TV about alternative screening methods, and I want to just address that so patients are aware. What about those tests that you can take at home, the stool tests? What do patients need to know about that, and how is it better to do that than a colonoscopy? Tell us a little bit about what we should do with that.
So we're very lucky to have some alternative screening methods. There are two main ones that we use. So one is called FIT. And basically these tests test for human hemoglobin. They're the next generation of testing for blood and stool. It used to be, when I was in medical school and residency, we didn't have these newer tests. And we would do what we call stool guaiac, which was nice to have for screening purposes, but it wasn't very specific for humans. Because if you, for instance, had a medium rare hamburger the night before, it could accidentally turn positive because it caught the cow hemoglobin, not human hemoglobin. Wow. Yeah. So, and there are a whole bunch of foods that can, unfortunately, in the old test, cause false positives. So we're very lucky. Now there's FIT testing, and that tests for human hemoglobin. And there's also Cologuard, which is a test that gets sent to someone's house, and they submit a stool sample, and that tests for both human hemoglobin and DNA markers, both in polyps and in colon cancer, colorectal cancer. So the advantage of that test is that it tests both for DNA markers plus human hemoglobin. There's a little bit of differences in how often you have to do the test. So the Cologuard test, you can do once every 3 years. If it's a negative test, and the FIT test, you have to do every year. So in order to stay current, so you do it for 3 years in a row. And they're both great tests. If those tests turn positive, then, there may be something concerning. And so in that circumstance, we get a colonoscopy as a follow-up to that. So those patients, if it turns positive, it's just a screening test to say, hey, there may be something concerning in the colon. We should do a diagnostic colonoscopy as opposed to a screening colonoscopy. And there's some unique circumstances when we can use those. They're great tests, especially for very sick patients. Someone with really bad heart failure, someone that's had a stroke and is on anticoagulation, and someone that is on anticoagulation for a stent, a cardiac stent. There's very specific patient populations where it's very helpful that we, the patient wants to get screened, but there's a good reason why they are hesitant to have a colonoscopy, because they're very sick. And it's nice to have this as a screening modality to buy us some time until they can safely have a colonoscopy. Also, if someone has a poor prep and, they were very insistent they didn't want a colonoscopy initially, and then, they decided to do a colonoscopy, but they didn't have the best prep and we couldn't see that well. And then they're insistent that we absolutely do not want a second colonoscopy to look again and try to achieve a better prep, because usually it's because they don't like the taste of the prep. And we can talk about that. We have a lot of great methods to make the experience a lot more pleasant for patients now. 2023 is an awesome year. We have
you'll like this, and what we're dying to hear what you say about the prep. But we talked to Dr. Burke, Carol Burke, last week, and she did a whole thing on the bowel prep, some tips and tricks. But we would love to hear your thoughts on that as well. But first, I want to go back, because I want to bring up, deciding what test is right for you, and that's really a decision you should make with your doctor, correct?
Yes, exactly. The best test is the best test that a patient actually gets performed. And so we have to talk to patients in clinic and really give them the options. If they're, if they want a colonoscopy, that's great. We don't have to do any extra work. Frequently we just have patients, they know they want a colonoscopy. That's all they want. But if patients are a little bit hesitant, it's great to have a conversation about all of the options that are available, because we have so many different ways to test. And usually if you just explain the preventive medicine aspect to it, that's enough to convince them. That's why we are so excited to do colonoscopies. That's why we're excited to do the Tune It Up concert. We want to raise awareness about colorectal cancer, that people are getting it at earlier and earlier ages, but also just as a reminder for people to get screened and for patients to get surveillance colonoscopies. Every time we do a colonoscopy afterwards, after we review the pathology, if there are any polyps to remove, we give patients surveillance recommendations. And sometimes patients aren't that excited to do their full-out colonoscopy. So this is a great reminder, done in a fun way through a concert, to have a conversation about colonoscopies and the importance of it. And, a lot of people who watch the concert say that was enough to convince me to get their colonoscopy, either the first time or surveillance, or, hey, I've been really bugging my parents about this. And the concert was enough to convince me to have that conversation with my parents, or maybe their parents watched the concert. We have a lot of patients 45 and up who watch our concert, and they start feeling guilty that they're not up to date on their colon cancer screening.
Yeah, and they probably come into your office singing and grooving. Yeah, it's time for my colonoscopy. So excited. No, but on a serious note, before we talk, I can't wait to talk more about the concert, because I watched the last two and they're so awesome. But I want to talk about the role of family history, like we said, and other risk factors that may be indicating that you should have a colonoscopy maybe sooner. So we have the age of 45 for average risk folks. That means what? No family history, no signs and symptoms, nothing no alarm signs, and that's great. But what about if, what is family history? Is it just my mother or father, or does it go out 2 and 3 degree relatives? And what about if I am African-American or Hispanic? Do I have greater risk? What do I need to know here?
All excellent questions. So it's important to know, I kind of referenced this earlier, but didn't fully explain. If there's early onset colon cancer, then patients should be getting colonoscopies at younger ages. If someone's got a family history of colon cancer in general, and they come to the gastroenterologist and they're asking for a colonoscopy, we're going to try to do it for them and try to get it approved by their insurance company. And usually we don't have any issues with that. And so you try to get a colonoscopy at age 40 or 10 years earlier than that relatives aren't set. So for instance, if someone had a father who was diagnosed with colon cancer at age 48, then we could approve doing a colonoscopy at age 38. So it's very easy to think of it like that.
Oh, interesting.
But in general, if patients are coming to us and, their parent had a colon cancer and they just want to get checked out, we don't have any problem, making sure, because here's the thing to really understand. We don't know all the genetics. And sometimes someone in their family, they may have hereditary risk that we haven't even identified. Genetics is amazing. It's come such a long way over the past 20 years, but we don't know everything. And so we look at age, but we also, try to make the patients happy. And as you can understand, someone that has a parent that was just diagnosed with colon cancer is very freaked out about their chances. And so a lot of times patients want an initial colonoscopy to make sure that they're okay. So we have that conversation. We go over the actual guidelines. We try to adhere to the guidelines. And we try to educate patients about, when they're supposed to be starting.
No, this is great. I really appreciate that. Let's talk briefly just about the colonoscopy prep, and not to fear the colonoscopy. So for any tips, for people that may have hesitations about the prep, it's come a long way, as we learned from Dr. Burke in our previous episode. But from your experience, what do you tell your patients who ask, or maybe a little bit afraid or trepidatious about the prep?
I let them know that the normal Go Lightly solution, which is what has been used for years, tastes a little salty, and there are ways to improve the flavor. So, and I just had my first colonoscopy. So now that I've had my colonoscopy, I actually got mine early. a little bit early.
You can't wait for the next one, right?
Yeah. So I have some experience with it, and it's a lot easier to talk with patients about now that I've experienced. So one thing, frequently the pharmacy has flavor packets that you can add. You can also add Crystal Light. What I recommend, and which is what I did, was I took a little bit of Gatorade. Not trying to promote the Gatorade company.
No, I did the same thing. It made it so much easier.
Powerade would work just as well. Make sure it's lemon lime, the yellow. We want it as clear as possible. And if you either have a couple of sips of that in between each sip of the Go Lightly, it'll make it taste better. One thing that I did was I actually poured the Gatorade into the Go Lightly container. I got 3 bottles of it, and two regular, 1 diet, just so it wasn't as sugary. And then I poured up to the line with water the rest of the way. So it makes it a lot more tolerable, the flavor. And then some other things are to refrigerate the prep. Makes it a lot better. Make sure you mix it up always, just to reconstitute it. And the other thing is, if you get a glass of white grape juice or apple juice, in between each glass of the Go Lightly, have a couple sips of the white grape juice or apple juice, and it'll take out the saltiness out of your mouth and make it a lot better. And I'm kind of goal oriented, so I was looking forward the entire time I was drinking the Go Lightly glass. I was looking forward to having a little bit of white grape juice.
So it's like you're chasing. You're like the cocktail extraordinaire.
Exactly.
Like, then you chase it back with the white grape juice.
Yeah, it was awesome. So those are some things. Now, separately from that, and I'm sure you talked about this last week with Dr. Burke, but there are some low volume preps out there. Suprep, movie preps, just 2 examples. And it's half the volume, a lot more tolerable. They were designed to make it easier to prepare for colonoscopies. And so a lot of our patients like that. But if anyone's got, heart failure, or they're really sick, they have some renal insufficiency, frequently we still prefer the Go Lightly. And, but you can have that conversation with your gastroenterologist or your primary care doctor, and we're happy to. There are a lot of other preps out there that you can do. The most important thing, though, is to not eat anything the day before your procedure. Have a clear liquid diet, and that's actually the hardest thing for patients outside of just drinking it, is to stay motivated throughout the day beforehand and really not eat anything solid, because we want it to be as clean as we possibly can get. Sometimes patients can have some low residue diet for breakfast. I would talk to your primary care doctor or gastroenterologist about that. I personally prefer patients just not to eat anything the day before. Yeah. Just clear liquids, chicken broth, Gatorade, Sprite, Jello, coffee, that kind of thing. No milk in the coffee. Tea's okay.
It's not as bad. I did I've had 2. With the first one, I had the Go Lightly, and that was a lot for me, like all that drinking. And the doctor at the time, I had to take these pills, and it was too much. The second time, it was the Suprep. That was great. Yeah. I thought that was so easy. And
it improves adherence to our recommendations. Definitely.
Yeah, it was much better. And I think the point here for patients is there are options. Like, you have to take this one. And in our other episode with Dr. Burke, she explains on how to talk to your doctor. And she mentioned, safety and price and what's covered by insurance. So there's other factors that really influence what you're going to take. But at the end of the day, it's really a collaboration between you and your healthcare provider to get the best result. And also follow the directions. Like, you can't wing this. You got to follow directions. Don't wait till the last minute.
I agree. And most gastroenterology outpatient surgical centers, or if you're coming into a hospital, they have ways to educate you several different ways over time. Someone will frequently call you to review the prep. There's a handout that's given. The prep itself actually has directions. And there's something to keep in mind. There are always these small differences in the instructions. So if you have any questions, just call the doctor's office. But the point is, in general, we can make it super easy for patients. Clear liquids the day beforehand, drink the prep the night beforehand. And we have a lot of data that shows, I'm sure you talked about this with Dr. Burke, is that split dose prepping improves the quality of preps. Cleaner colons for sure, We have a lot of data supporting this. I recommend, having a time period in between the first half of the prep and the second half of the prep. We encourage patients to definitely do what we call split dose prepping.
Love it. So now, we're going to talk about the concert. So first of all, it is amazing what you've accomplished this is the third one, right? Coming
Yes.
up. So tell us how you started this whole idea for the concert series.
So actually, I've been organizing concerts since college. I went to the University of Virginia and started a concert series there. And then when I got to med school at Emory, I was missing the opportunity to organize concerts. And I went to Emory University for medical school in Atlanta, which is literally next door to the CDC. We have a lot of cross-pollination, and everyone's looking for a way to work on public health projects with people who are working at the CDC. It's such a unique opportunity when you live in Atlanta. And I thought of the idea of combining music with medicine and public health. And I was actually inspired by the rock band Queen, who, after their lead singer Freddie Mercury died of AIDS, had started working. The remaining members of the band, guitarist Brian May and drummer Roger Taylor, were working with Nelson Mandela on organizing HIV prevention programs in both Africa and in Europe. And I thought, why aren't we doing something like this in the United States? Thought about it for a few days, called my best friend who was in medical school at Virginia, and we basically came up with an idea for Music Inspires Health, which is a rock and hip hop concert tour we organize around the country, featuring a whole bunch of different artists, including Trey Songz, who's a hip hop singer, Ingrid Michaelson, Ben Queller, a bunch of different rock musicians. And Kaiser Permanente became a national sponsor of ours, as well as we put together our National Medical Advisory Board, including several previous CDC directors of HIV, STD prevention, and deans at various different medical schools around the country. It was so successful
Awesome.
that a couple years later, I was starting to think of a way to work on public health projects again. We got really busy with all of my medical training, including residency and then fellowship, and I was in practice for a few years. When the pandemic started, I was actually, at that time, was co-chair of a series organized by the Chicago Symphony's Young Professionals Group, the Overture Council, called Soundpost. And we had organized 2 events that year, and all of a sudden, the last 2 events of that season got canceled because of the pandemic. So in April of 2020, I'm sitting at home, kind of disappointed that I'm not able to organize these amazing events that we had already had plans in place for, and they were about to happen. And one day I thought, all these musicians are at home and they want a way to connect with audiences again. Why don't I team up musicians from around the country of different genres of music and team them up with physicians and nurses on the front lines in order to give voice to the physicians and nurses, to encourage people to wear a mask and physically distance and teach them about COVID prevention. So we did 10 concerts of Concerts and Cocktails. It was held on Saturday night. The idea was to have a drink while listening to a concert, and to encourage you to take COVID seriously and to wear a mask. This was during the lockdown. After that, I was asked to become a TEDx speaker for TEDx Wrigleyville. And I actually gave a TEDx talk that was filmed at Wrigley Field in June of 2020, as the lockdown was being lifted in Chicago. And my talk was on how to build health education campaigns using music and concerts. And the president of the American College of Gastroenterology at the time, and one of the previous presidents, saw my TEDx talk and was like, why isn't he doing this for ACG? And I got an email asking me if I would be interested in organizing a similar event for Colon Cancer Awareness Month. And that's how this was born. And the first artist that we got on board, the first major artist, we had a couple others, was Lisa Loeb.
I love her.
Our first year, and Rufus Wainwright joined us in the Chicago Symphony, and it just kind of exploded. And the musicians were super excited to be able to contribute a pre-recorded performance for this concert. And we have done concerts in 2021, 2022, and now this is the 3rd installment. And it's free. It's streaming online. The concert's going to be on March 30th which is a Thursday night at 8 p.m. Eastern. And people can watch around the country. This year's concert is just going to be 1 hour. And amazingly, we were able to get Katie Couric's support, and she filmed a PSA for us, and we were able to show her PSAs the first 2 years. And it's amazing all the support that we've gotten. Last year we got Leonard Bernstein's daughter, Jamie Bernstein, to contribute a PSA for us as well.
That's
and
awesome.
we've had a couple of different TV celebrities contribute things as well. So it's been nice to be able to organize something that teaches about health, but in a fun way. We sprinkle the health education on top of the music. The concert's 90 to 95% entertainment, music performances. We have some really great health education messages. And it's great because we have all this additional stuff for Colon Cancer Awareness Month that the American College of Gastroenterology and other GI organizations organize. And this is kind of like the fun celebratory.
This is the awesome one. So who are some of the artists that are going to appear this year?
Thanks for asking. So Rufus Wainwright, again,
I love him.
Another video for us this year. He's been so supportive of our project, and he's great. I'd seen him live before I started organizing, but like every year, they've been Kay and his team has been providing us a new performance to share. So violinist Hilary Hahn, who is one of the top violinists in the world, and she's actually now a creative consultant for the Chicago Symphony.
Oh, wow.
Yeah, so she's actually performing a lot in Chicago. She's actually performing here this Sunday, but she contributed a video for us as well. This year, we also have the Berlin Philharmonic Horns.
Oh, cool.
Yeah, so there's a blues guitarist named Ali Venable, and she made a video performance with blues guitarist Buddy Guy recently, and she and her management team and record label were able to contribute this video for the concert, which is awesome. We have musicians from a lot of different genres of music. The Cincinnati Pops has also been very supportive of us. Carrie Ellis, who is a Broadway West End singer who has collaborated a lot with Brian May, the guitarist from Queen. She contributed something very special, which I hope you'll watch.
Of course.
We have a lot of different artists. KF Jacques, who's a hip hop.
I know. I love that. So cool.
Yeah. Ben Queller, who's a rock singer. We have a ton of different musicians. This is a fun concert. And I love teaching about health, but I also love introducing people to new kinds of music, new musicians, and new songs, and expanding people's horizons. So that's really why we came up with the idea of organizing concert with lots of different genres of music. So there's something for everyone. And that's the feedback I get afterwards. I'm like, oh my God, I've never listened to Cincinnati Pops before. Hilary Hahn, I've heard that name, but I didn't really know who that was. A lot of people do know who Hilary is. She, in the classical world, she is like Yo-Yo Ma for the violin. She's like Itzhak Perlman for the violin. And she's doing so many amazing things to introduce classical music to younger and younger audiences.
That's so great.
Yeah. So we try to get people with great personalities who love entertaining and who are really into this idea of teaching people about cancer prevention.
And it's amazing that you've been able to bring all these people together. These people are pretty famous people that are busy, and they take this time to contribute to this project, which really is an important project. Because all kidding aside, colorectal cancer is no joke, and people don't realize how much it can be prevented by just getting screened and knowing their risk and working with their doctor. So this is amazing, like what you put together. In your other life as a doctor, you do amazing things. You're saving lives, but you're also saving lives in this way because it's reaching so many people, the message, and it gets shared and shared and shared. So I commend you for doing what you're doing. And I watch these concerts. They're amazing. And I can't wait for March 30th again.
Yeah, well, we've been very lucky. It's both the musicians and sometimes it's the managers who, when we present the idea of them participating in the concert, frequently someone has an attachment, either a friend or a loved one who has been affected by colorectal cancer. And sometimes it's really easy to get the musicians on board that way. But we've had a lot of support from amazing music celebrities. Last year, Ben Folds contributed a song, which I love Ben Folds' music.
I know,
He's
me
so
too.
amazing. He's actually releasing an album right now that I'm excited for the release of. But in addition to that, Tim Reynolds, who's a really famous guitarist, he, has presented songs the first 2 years of the concert series. And, we were very, very, very lucky that these world-renowned musicians have identified this as one of the things they want to support.
It's fabulous. It's just fantastic. What's the URL to watch the concert?
gi.org/concert. Again, gi.org/concert. Organized by the American College of Gastroenterology as part of the PR committee that I'm on. I'm helping to organize it. We're so thankful to the American College of Gastroenterology for supporting this and helping us work with their communications and IT teams. And, the current president and the previous couple presidents have been instrumental in getting this project off the ground. It's such a unique way to reach audiences and the public and teaching them about public health. So we're very thankful for both ACG support and the musicians themselves. And it's going to be this March 30th, which is a Thursday night at 8 p.m. Eastern, 7 p.m. Central, 5 p.m. Pacific. So remember, where you are in the country, hopefully you can watch the live stream. We're trying to encourage many people to watch the live stream as possible. It's completely free. You just log on to that website and you hit play, and you'll be able to join the live stream and watch the concert as it unrolls. It's going to be a lot of fun. This year's concert's really, really good. We've been doing all the videos of the past couple of weeks, and I am so excited. And I want to thank all the musicians who contributed this year.
How excited are you?
Extremely. Yeah, it's awesome. This is my big project of the year. I work on some other stuff, but I get so excited for this because it really is a great combination of public health and music and entertainment. And it's one of the unique ways to be able to reach across the entire country all at once. And there's something very special about knowing that, there are people around the country watching at the same time as you, something that's involved with public health. And so it's a really, really cool feeling to know that there are people all around the country that are being affected by this health information that we're trying to teach people about.
Well, the impact is huge for sure. And again, thank you so much for your efforts. It was so great speaking with you tonight. Did we forget anything?
Yeah. Okay. Thanks for having me on. It was great.
Oh, I told you we were going to do this.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.